Right. We'll get back to these pre-open prices. Actually, we'll keep prices on the side. Kiran Mazumdar Shaw is joining us on the phone line on that deal that they've struck with Bristol-Myers. Thanks very much, ma'am. Good morning, Prashant this side.
Morning, Prashant.
Seems like you've managed to replace Pfizer with Bristol-Myers. Could you sort of take us through the basic contours of the deal?
No, that's a completely incorrect interpretation. Pfizer was for biosimilar insulin. This is for oral insulin. These are completely separate deals. And the agreement that we signed right now is an option agreement, which is really about, which will then trigger a licensing agreement once we establish some data points. If you recall, oral insulin was a program that had a setback because of a placebo effect. And what we are now doing with Bristol-Myers Squibb is to restart and redesign these trials to establish the true efficacy potential of the drug. And so it is, right now at the first step of a potential licensing deal. So I don't want to, excite everyone at this stage. There is work to be done. There is data to be demonstrated. And once that happens, it can be a mega deal.
Okay. I mean, so apologies. I mean, we've all been sort of waiting for that Pfizer thing and whether you'd be able to sort of find a partner for that, etc. So I kind of jumped the gun there. Ma'am, could you just take us through anything that you can share with us in terms of financials? I understand you don't want to.
Right now it's too early to talk about financials because it is about counting the chickens before they hatch. So I think right now it's really about focusing on establishing the data and making sure that when we do get into large global clinical trials, that we have all the data to indicate that this is a blockbuster drug.
And at what stage are these trials?
Well, these are going to be, largely sort of early stage, which is phase 2 kind of trials, where we will basically look at the drug and design trials in such a way that it actually tells us more about the drug. Right now, the kind of trials we conducted so far in India were, designed in such a way that it did not really show the true potential of the drug. I think they were early days for us. We were naive about clinical trial design. Now with Bristol-Myers Squibb on board, who are very experienced with clinical trial design, we believe that we will actually be able to then generate the kind of data that is required to make a success of this product.
Could you just give us an indication of the market opportunity, ma'am, for these kind of...
If the drug works, it's absolutely a blockbuster drug because this will revolutionize diabetes. So that's why we are so excited, and the drug certainly holds a lot of promise, but we have to make sure that the promise is realized and that, that it does deliver all that it promises.
So basically there is nothing... the deal doesn't have anything...
Right now, I would say the main announcement we are making is that we're going to restart the trials. And that's a very important step for us because the program had been halted. Because we didn't want to pursue this program until we got a partner on board who knew what to do. Because on our own, we felt that we were a little naive and, we hadn't designed the trials in a way that was giving us the data that we were looking for. In any case, we needed a global partner at the time of commercialization, and we felt that it's better to bring that partner in now so that they can help us design the trial. So right now, Bristol-Myers Squibb is coming in to help us redesign the trials. We will be conducting the trials largely in US and Europe, and they will be largely funding these trials. So from that point of view, it's not there's no licensing fee at this point. But in a year and a half or two, when the data starts coming out, we will certainly then trigger a licensing deal which will be substantial.
I know, but that, the terms of which have already been agreed through right now, right? I mean...
Yeah, we have, but unfortunately I will not be able to disclose those terms right now, but that's why I said it will be substantial.
Got that, ma'am. Thanks very much. Good luck. Appreciate you joining in with those sort of clarifications and important ones. Kiran Mazumdar Shaw at Biocon saying that they've signed an option agreement. Bristol-Myers to help Biocon with the clinical trials for the oral insulin drug. Huge market opportunity. If trials are successful, this has got the potential to be a big blockbuster drug. But that's at least about a year and a half, 2 years out. by the time the data is substantiated, and commercialization could be, I mean, even further out. But the terms of the deal have been signed now, and they've brought on Bristol-Myers at this stage, I mean, very early stage. The licensing, out-licensing kind of agreements would be triggered. Those are signed now, but those would be triggered with the success. Bristol-Myers is funding the clinical trials for now. 6 odd minutes to into the pre-open session. The Sensex is up about 21 points or so. The Nifty is off about 17 and a half points. I mean, so not very much going on. Bharti is up another 1.5%. We'll have Nisha up joining in just a bit with what CLSA is saying about telco.